Hello, I'm Dr. Birchansky, ophthalmologist at Fox Eye Laser Vision Institute. Today is March 30th, 1999. The purpose of this program is to give you adequate, up-to-date information about cataracts. You will learn what the most advanced surgical treatment currently is and what to expect before, during, and after surgery. The eye is like a camera. It has a lens that does the focusing, the film that takes the picture. The film of the camera is similar to the retina of the eye. In order for your eye to take a clear picture, you need a clear lens and a good working retina. A cataract is cloudiness of the lens of the eye, as if your camera lens was smudged with dirt. As we age, the lens becomes cloudy. The light can't get through to focus on the retina. It's like looking through a dirty windshield. People with cataracts may notice glare, halos around lights, difficulty with night driving. There may be difficulty seeing street signs in the distance, difficulty with reading and seeing small print, difficulty with seeing down the aisle in a grocery store or seeing across the street. Golfers may have difficulty tracking their ball. There may be difficulty threading a needle. It may be difficult to distinguish between dark colors like black and blue. You may require more light in order to read. Your vision may also fluctuate. If you have a cataract, the vision, when we check it with the eye chart, may be very blurred. But after cataract surgery, vision clears up very nicely. The most advanced state-of-the-art technique to remove a cloudy lens is a technique I call clear corneal no-stitch cataract surgery using a temporal approach and eye drop anesthesia. Pre-existing astigmatism is also reduced to help you see even better. Astigmatism is when the cornea of the eye is football-shaped instead of round. A 3 millimeter self-sealing incision is made into the eye. This wound is 2.5 times stronger than a stitched wound. The cataractous lens is then removed using sound waves through this very small incision. A clear foldable lens implant is then placed into the eye. This lens implant allows you to see relatively clearly immediately after surgery. The day after surgery, most patients will see well enough in the distance to pass their driver's license test without eyeglasses on, thus driving without restrictions. In 2 weeks, the eye is healed and you will be ready for new eyeglasses prescription to fine-tune your distance vision and to help you with reading. No-stitch or sutureless cataract surgery is advantageous because it allows you to return to normal activities immediately. Following surgery, you may lift, bend, stoop, cough, strain, exercise, and return to work. There is no need to wear an eye shield. You only need to wear protective eyewear if your work exposes you to particles in the air. When topical eye drop anesthesia is combined with the clear corneal sutureless incision, there is no risk of bleeding to the eye. Some of you are taking blood thinners like Coumadin and aspirin due to a medical condition. This is fine, and there is no need to discontinue these medications. In addition, eye drop anesthesia is safer because there are no needles. Thus, there are no risks to the eye such as retrobulbar hemorrhage, needle injury to the eyeball, or injection of the anesthetic into the brain's fluid. Sutureless cataract surgery is one of the safest surgeries performed with over 99% success. However, any surgery has risks. Risks of anesthesia include heart, breathing, and circulatory problems that could rarely result in death. Since sedation or local anesthesia is much safer than general, the procedure is done while you're awake but relaxed. The worst possible outcome could result in total loss of vision from infection or other causes. Although serious, this is extremely unusual. There are situations that can occur any time after surgery that can include retinal detachment, swelling of the retina, cornea, and others. These situations are very unlikely to occur, and if they occur, they usually can be treated. In my experienced and skilled hands, the success is extremely high and you should be thinking positively. Now let's talk about lasers. Surrounding the original lens is a thin layer of tissue called the capsule. This capsule helps support the lens implant. Months or years later, this capsule behind the new lens implant can become cloudy and vision can gradually decline. This can be easily corrected with a quick in-office laser procedure called YAG capsulotomy. Vision is restored immediately. Although the original cataract never comes back, this is what some refer to as laser surgery for a secondary cataract. In the very near future, I expect to be removing a cataract with laser as opposed to sound waves that is currently used. I continue to offer you the most advanced surgical techniques as soon as they become available. Unless your insurance specifies your surgery to be done at hospital, it will be done at Advanced Surgery Center. This is Cedar Rapids' first and only outpatient surgery center and is located within Fox Eye's building at 1136 H Avenue Northeast. You are not to eat or drink on the day of surgery unless otherwise instructed. You will arrive with family or a friend at Advanced Surgery Center a couple of hours before your scheduled time in order to receive dilation eye drops. Shortly before surgery, your eye will be numbed with drops, so you won't feel any pain. You will receive relaxation medication through your vein. Your family will be right outside the operating room observing you and your actual surgery through an observation window and closed-circuit microscopic video camera. In my experienced hands, the operation usually takes less than 10 minutes. You leave the operating room without a patch and you go to recovery. At recovery, you will be with your family. A nurse will go over the instructions for placing eye drops 4 times a day. Shortly thereafter, you leave. I will see you back the following day at the office. You may resume your normal activities except for driving that day. You may shower and wash your hair with your eyes closed. You may resume eating and all medications. If you have any eye discomfort, you should take Tylenol unless you are allergic to it. Enjoy the day and enjoy the improvement you may already have in your eyesight. How do you place an eye drop? You should first wash your hands. Tilt your head back and allow 1 drop to go into the eye. If more than 1 drop goes in, that's fine. Next, close your eyes for 5 minutes. You should then place 1 drop of the other eye medication in a similar fashion. This should be done at breakfast, lunch, dinner, and bedtime. Cataract surgery is offered to you when you are having difficulties with your vision and you would like to see better. If you have been offered cataract and lens implant surgery, it is because I feel that your sight would improve and you would benefit from the procedure. It is not an emergency to have the cataract removed. You can wait, although vision will continue to gradually worsen with time.
Dr. Lee Birchansky was born and raised in Miami, Florida. He graduated from the University of Miami School of Medicine in 1985. He completed his residency at the top-ranked University of Iowa Department of Ophthalmology in 1989. Thereafter, he began practicing in Cedar Rapids. In addition to being board certified in ophthalmology by the American Board of Ophthalmology, he is board certified in cataract and lens implant surgery by the American Board of Eye Surgery, thus the ABES initials after his name. Dr. Birchansky is dedicated to bringing the newest and best technological advances in eye surgery to eastern Iowa. In 1991, he introduced no-stitch cataract surgery to Cedar Rapids, as well as reintroducing corneal transplants. In 1992, he began using eye drop anesthesia for cataract surgery, and in early 1993, a temporal approach incision. 1994 brought a new technique called clear corneal incision. Dr. Birchansky began using acrylic lens implants in 1995 and multifocal lens implants in 1998 that eliminate the need for bifocal glasses after surgery. In 1996, Fox Eye was the first to bring an excimer laser to Cedar Rapids and offer laser vision correction for nearsightedness. Dr. Birchansky is the first to offer non-hospital cataract surgery in the comfortable setting of the Advanced Surgery Center located in our Cedar Rapids office building. Dr. Birchansky has performed over 6,000 no-stitch cataract surgeries, most of them by using eye drop anesthesia. He is truly a leader in his field.
My outstanding staff at both Fox Eye Laser Vision Institute and Advanced Surgery Center is a reflection of my strong commitment for setting the standards of excellence. I believe that you will find your experience to exceed your highest expectations. Please call us if you have any questions or comments.
Isn't it time you lose the glasses? Call Fox Eye for an information pack and then join the thousands that have come to Fox Eye to correct their vision. Fox Eye Laser Vision Institute.